NEX NLN quiz. Question 1. Which number is 15% of 200 in this diagnostic set item? Option A, 215. Option B, 300. Option C, 30. Option D, 185. The correct answer is option 15% means 15/100, so 200 times 15/100 equals 30. The other choices come from adding or subtracting the percent, moving the decimal incorrectly, or dividing in the wrong direction. Question 2. During a quick NEX review of a final review item, which word is closest in meaning to emphasize in a science paragraph? Option A, divide. Option B, stress. Option C, borrow. Option D, minimize. The correct answer is option. Emphasize means stress, so that choice matches the meaning in context. Divide means split, not stress. Borrow means take temporarily, not stress. And minimize means make less important, not stress. Question 3. After checking the choices in a question bank item, which answer identifies the substance dissolved in a solution? Option A, solute. Option B, solvent. Option C, catalyst. Option D, precipitate. The correct answer is option. The solute is the material being dissolved. Solvent does the dissolving, catalyst speeds a reaction, and precipitate is a solid that forms in solution. Question 4. If a workbook page stem gives one clear clue, which inference is best supported by the passage? A report says infection rates fell after staff completed a hand hygiene refresher. Option A. The refresher removed all risk permanently. Option B. Training may have improved compliance with hygiene practices. Option C. Training increased infection rates. Option D. Hand hygiene cannot affect infection. The correct answer is option. The sequence suggests training supported better hygiene behavior. The refresher removed all risk permanently is not supported by the passage. Training increased infection rates is not supported by the passage, and hand hygiene cannot affect infection is not supported by the passage. Question 5. When time is limited on a study notes question, which increase is shown from Monday 13 to Wednesday 23 in a simple practice chart? Option A, 10. Option B, 23. Option C, 7. Option D, 36. The correct answer is option. The increase is the final value minus the starting value, 2313 equals 10. The other choices use the final value alone, only the Monday to Tuesday change, or the sum instead of the difference. Question 6. Given the information in a revision guide item, which probability describes drawing a red card from a set with 4 red and 8 blue cards? Option A, 2/3. Option B, 1/2. Option C, 1/3. Option D, 3. The correct answer is option. Probability is favorable outcomes divided by total outcomes, so the result is 4/12, simplified to 1/3. The other choices use blue cards, compare red to blue only, or invert the fraction. Question 7. Suppose a similar crash course item appears on test day. Which word is closest in meaning to frequent in a science paragraph? Option A, heavy. Option B, often. Option C, silent. Option D, rare. The correct answer is option. Frequent means often, so that choice matches the meaning in context. Heavy means weighty, not often. Silent means without sound, not often. And rare means not often. Question 8. While working through a timed online quiz set, which answer identifies the transfer of heat through direct contact? Option A, radiation. Option B, evaporation. Option C, conduction. Option D, convection. The correct answer is option. Conduction transfers heat when particles collide through direct contact. Radiation transfers energy by waves, evaporation is liquid changing to gas, and convection moves heat through fluid circulation. Question 9. Before choosing an answer in an answer key item, which inference is best supported by the passage? A clinic sends appointment reminders, and missed visits decline. Option A, reminders can help patients remember appointments. Option B, reminders caused more missed visits. Option C, patients cannot benefit from reminders. Option D, appointments no longer need scheduling. The correct answer is option. The decline in missed visits supports the role of reminders. Reminders caused more missed visits is not supported by the passage. Patients cannot benefit from reminders is not supported by the passage, and appointments no longer need scheduling is not supported by the passage. Question 10. A student sees this sample test idea on a NEX review. Which answer identifies the transfer of heat through direct contact? Option A, conduction. Option B, radiation. Option C, convection. Option D, evaporation. The correct answer is option. Conduction transfers heat when particles collide through direct contact. Radiation transfers energy by waves. Convection moves heat through fluid circulation, and evaporation is liquid changing to gas. Question 11. One test bank practice problem tests this skill. Which milliliter amount equals 0.5 L? Option A, 50 ml. Option B, 5 ml. Option C, 5,000 ml. Option D, 500 ml. The correct answer is option. 1 liter equals 1,000 ml, so 0.5 times 1,000 equals 500 ml. The other choices use 10, 100, or 10,000 as the conversion factor, which shifts the decimal to the wrong place. Question 12. Several choices look tempting in a skill practice item. Which word is closest in meaning to maintain in a science paragraph? Option A, destroy. Option B, preserve. Option C, invent. Option D, compare. The correct answer is option. Maintain means preserve, so that choice matches the meaning in context. Destroy means ruin, not preserve. Invent means create, not preserve. And compare means note similarities or differences, not preserve. Question 13. For this learning module nursing entrance question, which answer identifies the repeating a study to see if results hold? Option A, classification. Option B, replication. Option C, bias. Option D, estimation. The correct answer is option. Replication checks whether results are reliable across repeated trials. Classification is grouping items, bias is a systematic error, and estimation is an approximate calculation. Question 14. In a short structured test practice STEM, which inference is best supported by the passage, a study found that students who practiced with timed sets felt more comfortable during the actual exam. Option A, comfort never changes with practice. Option B, timed practice can build exam familiarity. Option C, the exam has no time pressure. Option D, timed sets remove all content gaps. The correct answer is option. The passage connects timed practice with increased comfort. Comfort never changes with practice is not supported by the passage. The exam has no time pressure is not supported by the passage, and timed sets remove all content gaps is not supported by the passage. Question 15. Among the choices in a full practice item, which critical thinking response best fits this situation? A test item asks for the best answer, and two choices are true but only one directly answers the STEM. Option A. The first familiar term should be chosen. Option B. Any true statement is always best. Option C. The longest answer is automatically best. Option D. The choice that directly answers the STEM should be selected. The correct answer is option. Entrance exam items often include true distractors that do not answer the specific question. The first familiar term should be chosen does not follow from the situation. Any true statement is always best does not follow from the situation. And the longest answer is automatically best does not follow from the situation. Question 16. Using the facts in a nursing entrance question, which sum equals 1/6 plus 1/2? Option A, 1/3. Option B, 2/3, 1. Option C, 1/2. Option D, 2/3. The correct answer is option. The denominators are already the same, so add the numerators, 1 plus 3 equals 4, then simplify to 2/3. The other choices subtract the numerators, multiply parts of the fractions, or change the denominator unnecessarily. Question 17. Based on the clue in a pre-nursing prep item, which word is closest in meaning to omit in a science paragraph? Option A, leave out. Option B, include. Option C, predict. Option D, polish. The correct answer is option. Omit means leave out, so that choice matches the meaning in context. Include means put in, not leave out. Predict means forecast, not leave out, and polish means make smooth, not leave out. Question 18. Consider this high-yield verbal practice concept. Which answer identifies the tiny vessel where nutrient and gas exchange occurs? Option A, vein. Option B, trachea. Option C, artery. Option D, capillary. The correct answer is option. Capillaries have thin walls that allow exchange with tissues. Vein returns blood to the heart, trachea carries air, and artery moves blood away from the heart. Question 19. Near the end of a math practice review session, which answer best explains the author's point? A patient education sheet used short sentences, headings, and pictures. Option A, pictures make written instructions unnecessary. Option B, clear formatting helps readers understand health information. Option C, long paragraphs are best for patient teaching. Option D, headings reduce the value of information. The correct answer is option. The sheet is designed to improve readability and comprehension. Pictures make written instructions unnecessary, is not supported by the passage. Long paragraphs are best for patient teaching, is not supported by the passage, and headings reduce the value of information, is not supported by the passage. Question 20. Across similar science practice nursing entrance questions, which increase is shown from Monday 12 to Wednesday 20 in a simple practice chart? Option A, 32. Option B, 8. Option C, 20. Option D, 5. The correct answer is option. The increase is the final value minus the starting value, 2012 equals 8. The other choices use the final value alone, only the Monday to Tuesday change, or the sum instead of the difference. Question 21. Since only one choice fits the biology review clue, which dose volume gives 300 mg from a supply of 150 mg per 1 ml? Option A, 0.5 ml. Option B, 2 ml. Option C, 1 ml. Option D, 4 ml. The correct answer is option. Set up the proportion 150 mg, 1 ml equals 300 mg x ml, so x equals 300 times 1, divided by 150 equals 2 ml. The other volumes reflect errors such as doubling the dose, having the dose, or reversing the proportion. Question 22. From the information in a chemistry basics item, which word is closest in meaning to prohibit in a science paragraph? Option A, compare. Option B, forbid. Option C, repair. Option D, permit. The correct answer is option. Prohibit means forbid, so that choice matches the meaning in context. Compare means examine likeness or difference, not forbid. Repair means fix, not forbid, and permit means allow, not forbid. Question 23. At a testing desk during a critical thinking review, which answer identifies the organ that produces bile? Option A, gallbladder. Option B, liver. Option C, pancreas. Option D, kidney. The correct answer is option. The liver produces bile, which helps digest fats. Gallbladder stores bile, pancreas secretes enzymes and hormones, and kidney filters blood. Question 24. Inside a comprehension drill science or skills item, which answer best explains the author's point? A volunteer program grew after former patients shared personal stories at orientation. Option A, personal stories can motivate people to participate. Option B, orientation should never include stories. Option C, volunteer programs grow without communication. Option D, of former patients stopped the program. The correct answer is option. The passage shows participation increased after meaningful stories were shared. Orientation should never include stories, is not supported by the passage. Volunteer programs grow without communication, is not supported by the passage, and former patients stopped the program, is not supported by the passage. Question 25. Through careful reading of a reading skill stem, which answer identifies the group that does not receive the experimental treatment? Option A, experimental group. Option B, sample. Option C, conclusion. Option D, control group. The correct answer is option. A control group provides a comparison for the treatment group. Experimental group receives the treatment, sample is the participants or items studied, and conclusion is the final interpretation.